Hi, my name is Kristen. I'm a nurse and I am studying at SNHU. Today I'll be completing my physical examination on a volunteer patient, which I have already obtained a verbal and written consent from. Right now I'm going to go ahead and do a 360 of my room. And on this side table over here, I just have my props. So this is just a piece of paper that has writing on the front and then nothing on the back. Okay, so we're gonna go ahead and begin physical assessment. So first I'll enter the exam room and I'll introduce myself. Hi, my name is Kristen, I'll be your nurse. Can you tell me the first letter and last letter of your name?
B-L.
Perfect. And can you tell me today's date?
6/23/24.
And do you know where you are?
At my home.
Perfect. So now I'm going to go ahead and close the curtain and perform hand hygiene. Alright, so before we begin the actual physical assessment, I'm going to ask you a few questions. So can you count back from 100 by sevens?
100, 93, 86, 79, 72, 65, 58, 51.
Perfect. Okay, so the patient's attention is intact. Now I'm going to go ahead and test your comprehension. So I'm going to have you read this piece of paper out loud, and then you tell me, do what it says.
Take paper in left hand, fold it in half, and place it on floor.
Perfect. So the patient's comprehension is intact. So now I'm going to go ahead and test your long-term and short-term memory.
Okay.
So I'm going to give you 4 words. I want you to repeat them back to me. Dog, cat, tea, coffee.
Dog, cat, tea, coffee.
Perfect. And now I want you to count back from 20.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
Perfect. And now can you repeat those 4 words back to me?
Cat, dog, tea, coffee.
Perfect. Okay. And can you tell me what you did for your birthday last year?
I went to my mom's for dinner.
Perfect. So the patient's long-term and short-term memory are both intact. So now I'm going to go ahead and start the physical portion of your exam. We're going to start with your skin.
Okay.
So first I'm going to look at her skin. I'm just looking at the color. I'm making sure there's no abrasions or bruises, any abnormal moles. I'm going to look to make sure color is intact and skin temperature is warm. She is also the right color for her ethnicity. So I'm going to go ahead and check her capillary refills. Perfect. So capillary refills in the hands are less than 3 seconds. I'm going to check her toes. Perfect. So toes is also capillary, is less than 3 seconds. Perfect. So now what I'm going to do is I'm going to look at her face. So I'm looking at her eyebrows. They're both symmetrical. The hair is present, same as the eyelashes. I'm going to look at her scalp and her hair. Her hair is thick and coarse. I'm going to go ahead and feel her hair, make sure there's no lumps or bumps, and make sure there's no balding spots or alopecia. Any tenderness when I push?
No.
Perfect. And now I'm going to go ahead and check her lymph nodes in her head, clavicle, and axillary area. Perfect. So no abnormalities or enlarged lymph nodes. So now what I'm going to do is I'm going to look at your eyes. So first I'm looking at her eyes. I'm going to make sure they're symmetrical and they're round. The sclera is white. So what I'm going to do first is check your reactivityness. So I want you to look straight ahead. Good. Perfect. So both pupils react to light. What I'm gonna have you do now is I'm going to have you look straight at my pen, and I'm gonna have you follow it. Perfect, and now I want you to look at my pen again. Perfect, so pupils are round and reactive to light and accommodation. And pupils, cranial nerves 3, 4, and 6 are also intact. What I'm gonna do now is, if I had a Snellen chart, if I was in an exam room, what I would do is have the patient stand 20 feet. I would have them cover one eye, read what's on the chart to the best of their ability, do the same with the opposite eye, and then would do both eyes, and then that would be testing cranial nerve 2. So now I'm gonna go ahead and move to her ears. First, we're gonna look at her ears. They are symmetrical, they are the same size, there is no lumps or bumps. I'm gonna palpate for any tenderness. Any tenderness?
No.
Perfect. I can also look in her ears. I can see if there's any open areas or drainage, which there are not. Perfect. I could also, if I had an otoscope, I could also check her her membrane, and it should be pearly gray. So now I'm going to perform a whisper test. I'm going to have you cover one of your ears.
Dog.
All right, now the other side.
Cat.
Perfect. So whisper test is normal. So what I'm going to do now is I'm going to go ahead and move to your nose. Nose is symmetrical. I'm going to go ahead and have you tilt your head back. Perfect. The nose is moist and pink. I don't see any open areas or cuts in the nose. I'm going to go ahead and have you block one nostril and breathe in. And the same with the other one. Perfect. And now I'm going to have you close your eyes. And tell me what you smell.
Cinnamon.
Perfect. So let's see. So cranial nerve 1 is intact. So now we're going to go ahead and move on to your throat. First, I'm going to look at her lips. They are moist and intact. There's no open areas or growths on them. I'm going to have you open your mouth and say ah.
Ah.
Perfect. Uvula is midline. Mucosa is pink. All teeth are intact. I'm going to have you stick your tongue out. Move it side to side and up and down. Perfect. So now I'm going to go ahead and test your TMJ. I want you to open your mouth and close it. Open again. Perfect. So I don't hear any clenching and I don't hear any clacking or clicking. So what I'm going to have you do now is clench your teeth, purse your lips, close your eyes, raise your eyebrows, puff out your cheeks. Perfect. Cranial nerves 9, 10, and 12 are intact. So what I'm going to have you do now is I'm going to check your temporal arteries. Perfect. I'm going to check the carotid arteries. I'm going to check your brachial pulses. Good. And your radial pulses. And your popliteal. And your posterior tibialis. Good. And your dorsalis medialis. Perfect. And now I'm going to check your frontal and your maxillary sinuses. I'm going to palpate them. Let me know if there's any tenderness. Any tenderness?
No.
And how about here?
No.
Perfect. So now what I'm going to do is I'm going to listen to your temporal arteries with the bell of my stethoscope. Good. And now I'm going to listen to carotid for 1 full minute. Good. Now the other side. And I'm going to listen to it again with the bell, the diaphragm. Good. Good. now we're gonna move on to the cardiac system. So what I'm gonna do first is I'm gonna listen to her heart sounds. We're listening for S1, S2. So we're starting at the second right intercostal space for the aortic, the second left intercostal space for the pulmonic, the third left intercostal space for the Erb's point, tricuspid for the fourth left intercostal space, and in the fifth left intercostal space, mid-clavicular line for the mitral. And we're gonna do the same thing again with the bell. So the second right intercostal space for the aortic, second left intercostal space for pulmonic, third left intercostal space for Erb's point, fourth intercostal space for tricuspid, and the fifth is the left intercostal space mid-clavicular line for the mitral. Good. And heart sounds are normal, and S1 and S2 are heard, and there is no bruise. Okay, so now we're gonna go ahead and move on to our respiratory. So first, what I'm gonna have you do is I'm gonna put my hands below on your chest, and I'm gonna breathe in and out. Perfect. One more time. Perfect. So the chest is symmetrical, it moves in and out normally, and there's no bellowing. So first, now I'm gonna listen to the lung sounds. Just take some nice deep breaths in and out. Good. 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 Perfect. Now I'm gonna move to your back. Same thing, but just take some nice deep breaths in. Good. 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 Perfect. And now what I'm gonna do is just turn your chair to the side for me. Right here, perfect. I'm gonna check, I'm gonna have you lean forward. I'm gonna check for tactile firmness. So what I'm gonna have you do when I place my hands on your back, just say 99.
99, 99,
Perfect.
99,
Perfect.
99,
Perfect.
99.
Perfect. And now you're gonna do the same thing. When I place my stethoscope on your back, you're gonna say 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Okay. So what I'm gonna have you do is I'm going to just check for CVA tenderness. So I'm gonna have you lean forward, and I'm just gonna percuss. Let me know if you have any pain. Any pain?
Nope.
Perfect. Okay. You can go ahead and move your chair back. Okay. Perfect. Any questions for right now?
No.
Perfect. Okay. So now what I'm gonna actually do is I'm gonna check your abdomen at this point. So I'm gonna have you lay on the couch.
Okay.
Do you want the pillow or not?
Pillow's fine.
Okay. Perfect.
Let me take my shoes off so I don't dirty the couch.
Thank you. Okay. So I'm gonna have you keep your hands right at your side for me. So first thing I would do is I would inspect her stomach. I'm gonna just look at it, make sure there's no any protruding or anything like that. If she was in a gown, I would check for bruising as well. So first thing I'm gonna do is I'm gonna auscultate the bowel sounds, and I'm gonna start in the right lower quadrant and move my way around. Good. So bowel sounds are heard in all 4 quadrants. If I didn't hear bowel sounds, I would listen to each quadrant for 1 full minute. Now what I'm going to do is I'm going to percuss her abdomen in a zigzag pattern. Perfect. Okay, so now what I'm going to do is I'm going to palpate her stomach, but before I palpate, I want to check with her to make sure she has no abdomen tenderness or any pain. Have you had any abdominal discomfort or tenderness?
No.
Perfect. So what I'm going to do is I'm going to gently press on your abdomen and your quadrants. Let me know if there's any pain or discomfort.
Okay.
Any pain or discomfort?
No.
Perfect. Okay. And now while you're lying here, I'm going to go ahead and listen to your aortic, renal, and femoral arteries. We'll start with the aortic. And then the renal. And then your femoral. Perfect. And while I'm down here, I'm just going to feel your femoral arteries. Perfect. Okay, you can go ahead and sit back up for me for right now.
Okay.
All right, so now you can stay on the couch if you'd like. So we're going to check your musculoskeletal system. So what I'll have you do is actually I'll have you have a seat for right there in the chair for right now.
Okay.
So first what I'm going to do is I'm going to look at your joints. So
Okay.
I'm going to look for any swelling, any bruising, anything out of that ordinary. So let me just see. Perfect. No swelling noted in the elbows, wrists, or fingers. No swelling in the ankles. No swelling in the kneecaps. Perfect. So now what I'm going to do is test your strength.
Okay.
So we're going to start with your neck. So what I'm going to have you do is put your neck down and up and side to side. Perfect. And now I'm going to have you put ear to shoulder and then the other side. And now I'm going to test your strength. So push down and push back and push resistance. Push resistance. Perfect. So now we're going to do your arms. So up, down to the side, and then up, side, and then down. Perfect. And now you're going to do your elbows. So flexion, extension, and then we're going to do your wrists and hands. So like this, and like this, and then go push to the side, and then push in. Perfect. So now what I'm going to do is I'm going to test your strength. So now for your shoulders, just push up against me. Perfect. And now put your arms out. Don't let me push them down. Don't let me lift them. Good. Now for your fingers, grip my hands for your strength. Go ahead and grip. Perfect. Nice even grip on both sides. So now I'm going to do the same thing with your wrist. Don't let me push them down. Pull them up. Good. Now for your feet, I'm going to have you, if you want to take your shoes off, perfect. So I'm going to have you point your toes down, both feet on the other side too. And then I'm going to have you point them up.
At the same time?
Yep. You can do either one or the other. And then I'm going to have you scrunch your toes and then stretch your toes. And then I'm going to do the same thing. I'm going to have you push up and down, okay?
Okay.
Push. Perfect. And then up. Good. Perfect. Okay, so now what I'm going to have you do is lie back down so I can test your hips and your knees.
Okay.
So what I'm going to have you do is lift your leg all the way up. Same one on the other one. Good. Perfect. Now put both legs to the side. Yep. And the other one as far as you can. I know with the couch. Perfect. Now with your knees, do the same thing. Up and up. Perfect. And then knee to the side like this, almost like an adduction. An abduction. Perfect. Now the other leg. All right. Perfect. So I'm just going to test your strength. So put your legs up. Perfect. Don't let them push them down. Push against me. All right. And same with the feet. Good. Perfect. Okay. So now I'm going to have you stand up again. And what I'm going to have you do is I'm going to touch your spine. So I'm going to have you bend over, touch your toes as far as you can. Perfect. And now backwards. Good. And now lateral bend to the left, and a lateral bend to the right. Perfect. And now, what I'm gonna have you do is I'm gonna actually have you stand with feet together, close your eyes, and I'm doing the Romberg test. So what I'm looking for is any swaying or imbalance, and she is not doing any of that, so you can go ahead and open your eyes. So now what I'll have you do is walk to the room, walk to the couch, and walk back. Perfect. And now I'm gonna have you turn around, and I'm gonna have you walk on your heels. Perfect. And now on your way back, you can stop, and then turn around, and I'll have you walk on your toes. Perfect. All right, and now what I'll have you do is take your right heel and down your left shin. Perfect. And now the same with the other side. Perfect. All right, you can have a seat. Okay, so now I'm gonna go ahead and test a few more things for you. So what I'm gonna have you do is close your eyes. I'm gonna put 2 objects in your hands. You let me know what they are.
Okay.
All right, put your hand out. Go ahead, you can feel it.
It's a coin, quarter maybe?
Perfect. Okay, I'll take that, and same thing with this one.
It's a tie of some sort, like a scrunchie.
Perfect. Thank you. All right. And now what I'm gonna have you do is put your palms out. I'm gonna draw a letter and then a number in each of your palms. You let me know what it is.
Okay. The letter B.
Okay,
The letter Z.
perfect. And now we're gonna do a number.
The number 2.
And then this one.
The number 4.
Correct. Perfect. Okay, so let me think. I think you can go ahead and open your eyes for me.
Okay.
Thank you. Let me just think here, make sure I didn't miss anything. Okay, so 2 more things we have to do, and then I think that completes our assessment. So what I'm gonna have you do is touch your finger to my finger, and then to your nose, and then fast. Perfect. Perfect. And now what I'm gonna do with your thumbs, you just go like this. Perfect. Perfect. All right. So I think that completes our physical exam. Do you have any questions?
No, I do not. Thank
Perfect.
you.
Thank you so much.
You're
Have a
welcome.
good one.
Thank you.